Welcome back to Capitol Side. I'm Tim Boyle. Physician assistants are a crucial but often unsung part of providing health care across the country. Today, hundreds of PAs and PA students were at the General Assembly pushing for a handful of changes with the North Carolina Academy of Physician Assistants. They say those changes would both move the healthcare industry forward and help improve patient care. Joining us now for more on this is the president of the Academy, Christopher Norman. Mr. Norman, good to see you. Thank you for joining us, sir.
Yeah, thank you for having me. I'm glad to be here.
Absolutely. This stuff often gets confusing for people. So if you could firsthand tell us kind of the physician assistant's like large role and the difference between, say, a doctor or nurse, et cetera.
Sure. Physician assistants are licensed healthcare providers that go through some very rigorous training. Most programs are 2 to 3 years long. And then we go through our licensing with the North Carolina Medical Board, just like our physician colleagues. And then we practice in a team-based setting with our physicians at whatever organization you're working with. But we have always have a physician partner in the organization where you're employed.
One thing I've noticed too, particularly in an area that's growing like the Triangle or Charlotte or whatnot, they have played an increasingly large role, particularly with places that are hard to get appointments, et cetera. Like it's a vital role in areas like North Carolina in particular, right?
Absolutely. It is hard pressed to find any medical specialty that doesn't have a PA working in there. And one of the unique things about being a PA is being able to get out and provide that access to care that otherwise wouldn't be there, especially in some of the more rural areas or in some of the specialties where you need your physician doing some highly specialized procedures, but getting that first appointment or that access into the clinic with the PAs is vital. And that's one of the beauties of our profession, where we can provide that service to our patients in North Carolina.
All right, so from a healthcare setting down to Jones Street in the General Assembly, what are you asking for? What do you think could make it even better?
Well, at this point right now, we have something in the Senate Bill 190, that is a PA compact license bill that will ease the restrictions of getting PAs into the state. Right now, it takes a lot of red tape and overhead, and it's all good things for patient safety, but it takes weeks to get a medical license, sometimes a couple of months to get a medical license. And so the compact license, if you have a medical license in another state that participates with a compact license and you're in good standing, it will expedite the process of getting a medical license here in North Carolina, and therefore get PAs here quicker, taking care of patients easier in a more expedited fashion. And so that's one of the things we're out here at the Capitol today working on. And the other is in the next day or so will be another bill filed for team-based care that will remove even further administrative burden off PAs that are practicing very closely and with their physician colleagues and partners, and that have 4,000 hours or greater of experience in the workforce.
The compact bill reminds me sort of a teacher reciprocity thing we've seen in the past with teachers going to other states. Is it kind of a similar concept?
It's very much similar to a teacher reciprocity, or we liken it to a driver's license, right? So if you have a license in one state, it's honored in another, where you still have to apply to the medical board, but it happens much more fast and expedited, so we can get you here, get you practicing, get you taking care of the patients here in North Carolina a lot faster. So it's very, very similar to those.
I would imagine concerns are to make sure that the people that are coming in are of the level that we would want in the state. Are licenses from other states, is that largely sort of a baseline that is the same across states, or can it be very different?
Largely, it's the same. So everyone's going to have states going to have their own licensing regulations, but largely it is the same. And then once you actually, with the compact license bill, once you actually have your medical license here in North Carolina, the medical board still goes back and does all their processes and validation of all your credentials and background checks and things like that on the back end after you already have your compact license, still to protect the patients of North Carolina.
So what could be the impact of this? I asked the question earlier about growth and whatnot. Is that a big part of this? To help? I know people complain every day about not being able to get appointments places for months. Is that really the end goal here, outside of the obvious ease for folks like you that would want to come to the state?
Absolutely. It really comes down to access to care. So we want good PAs practicing here in our great state of North Carolina, and we want it to be easy for them to practice here. We also want to take care of our patients, and we want our patients to have very high quality health care. And so anything that we can do to increase the access to that health care and increase the number of providers coming into our state is beneficial for our patients.
One last question. I know there's a couple doctors in the legislature. I'm assuming you worked with some of them on this. What are your expectations for these bills moving forward? I know that's a tough question to ask a physician, a political question, but are your expectations that this is going to at least move forward?
I absolutely think it's going to move forward. We've worked with our physician colleagues. The team-based practice bill has been in previous sessions. And never made it all the way to the finish line for to being signed into law for a couple of reasons. But broad speaking, there are really no opposition to either one of these bills from anyone at this point. And so even the past ones have soared through and then gotten held up in different committees and different reasons didn't come through. But none of it was true opposition to the language of the bill. It just got wrapped up in other sort of other needs for the state. And then for the compact license, we've heard no opposition at this point, nothing but good things. And so we're expecting these things to move right on through and hopefully very smoothly.
Okay. Well, we'll see what happens. We'll continue to follow it in the meantime. Thank you for your time tonight. Good to see you.
Yeah, thank you so much for letting me come. I appreciate it.
All right. That's going to do it for tonight, folks. As always, if it's on Jones Street or Main Street, you'll find it right here in Capitol tonight. Stay safe. Look after each other. We'll see you right back here tomorrow night.